Hey everybody, welcome to Healthline. I am Gregory Zarian. So spring is here, summer's on its way. Are you getting off your phone? Are you turning off your computer? We know that Zoom is so important in our everyday lives, but that does not mean you don't get up, get out, and just breathe in some fresh air, get some activity on, do it with your family, your friends, and as we do here all the time at Healthline, we invite you to be as healthy as possible. And that means we also engage you in the conversation of health and lifestyle. And the more you know, the more you can pass on to your friends and family. Our conversation today is all about breast cancer. We usually talk about it in October, which is Breast Cancer Awareness Month, but we feel it's such an important topic, we want to address it this spring. So joining us from Adventist Health Glendale is the chair of the Cancer Committee, Dr. Boris Bagdasarian, a personal family friend who I love, and a returning guest who we have had on the show many, many times, breast cancer surgeon, Dr. Dennis Holmes. Gentlemen, welcome.
Thank you.
So great to be here.
I feel like I'm with the dream team.
Thank you. Thank you.
Breast cancer, it is such a, last year it was considered, even this year, considered the biggest cancer known globally. Breast cancer took out more people last year than it did anywhere from research that I did. Why is it still so on the uptick? Boris?
Well, the general population is aging, and as the baby boomers are getting older, typically the majority of the patients who develop breast cancer are older women. Although we're seeing younger individuals with this disease, it's been steadily rising. 15, 20 years ago, we had about 180, 190,000. It's nearly up to 260, 270, if not higher. And so as the population ages, so does the number of cases that are generated on an annual basis.
But Dr. Holmes, since we've spent so much time talking about it, do you find with all that we're trying to do, are we missing something as it's climbing, or as Dr. Bagdasarian said, it's just age?
Well, there are things that are being missed, but I think most importantly, you should recognize it as just a disease of aging. And there's actually good news in that, because people are living longer. With longer years, there's more opportunity for cancers to form, but most of these cancers are non-aggressive. They can be treated in non-aggressive ways. For the most part, they don't impact the lifespan of the patient. They live on to die of another cause. So there's hope in that. The main message that you're going to leave here with today is it's important to find it early so that when it's found, it can be managed and it can be a non-issue for their lifespan.
Thank you so much. More Dr. Holmes and Dr. Bagdasarian when we come back, and as I invite you to do, maybe do 20 jumping jacks, do 15 push-ups, and have a lot of water. We'll see you on the other side. Don't go away. Welcome back to Healthline. I am Gregory Zarian, so hope you had some water. Hope you did those jumping jacks and push-ups, and if anything, took 10 deep breaths. Our conversation today is all about breast cancer awareness, and what you can do to know the signs and symptoms. Joining us from Adventist Health Glendale is Dr. Boris Bagdasarian and Dr. Dennis Holmes. Like I said, gentlemen, dream team. Personally, you've been involved in my life and family members, and you come in with this wealth of knowledge and compassion. So when people come to see doctors, sometimes I feel like there's this separation, and personally, just to say thank you to you from my family, you come in with this heartbeat. And from our experience, Dr. Holmes, same thing with you. And that's why I sit in this chair and talk about this hospital, because my father, over 30 years ago, was really impactful in creating the heartbeat of this hospital. So it is a pleasure to be with both of you and get to talk about this cancer. And as you said, Dr. Holmes, we can prevent it and treat it, and just because you have a breast cancer diagnosis doesn't mean that it's a death sentence. So in that, what do we need to know, doctors, about what breast cancer is? We've talked about it a lot here, but from the basics, what is it, Dr. Bagdasarian?
Breast cancer is a malignancy that is derived from in either two locations, predominantly in the ducts, the minority within the milk glands called the lobules. And essentially, just like any malignancy, there's a genetic alteration that leads to development of malignant cells. So they go through a series of mutations, and if there's enough mutations, those cells that are atypical then become dysplastic and ultimately malignant. And then they develop into and appear radiographically at times with microcalcifications in the early stages of in situ disease, and then ultimately can lead to development of nodules and mass-like structures within the breast. So it's essentially a genetic alteration of cells that become malignant and start to proliferate and lead to development of a mass.
And Dr. Holmes, it is hereditary.
A subset, a small subset of cancers are hereditary, but it can be about 5 to 10, maybe 10% at most.
Yes.
Breast cancers are hereditary. Most are simply chance events. They're the consequence.
Can you say that again? Because when you say chance events, is a lot of it environmental?
It's multifactorial.
Okay.
Environment is a part of it. Lifestyle is a part of it. Genetics, not necessarily hereditary genetics, but differences in how your genes interact with the environment, it's a part of it. And it's really a result of a life of experience. There are many things that happen or don't happen in the span of a person's life that can lead cells to become abnormal, dysplastic as you mentioned, or atypical, and that can lead to a cancer formation. The body is designed to correct errors as they occur, so mutations happen all the time, but
Are they happening now?
they're happening now. And they're being repaired now as well. But sometimes the body's imperfect, and maybe stress, lifestyle, other factors kind of inhibit your ability or block your ability to repair damaged cells. Those damages can accumulate, they can lead to mutation, which can lead to cancer.
So out of the gate, what are signs and symptoms of breast cancer?
We recommend our patients to always have annual mammography to reduce the development of signs that are ominous, such as
an age?
pain and development of a large lump or painful lump that at times could invade the dermal lymphatics and lead to this appearance of peau d'orange, which is this peel of orange type of. This happens in some advanced cases, but again, when you have signs and symptoms, that's usually in a more advanced setting. And again, that's where cancer screening has been so important. And it's true that we're seeing a larger number of patients with these malignancies. As Dr. Holmes alluded to earlier, if it's caught early, it could be surgically addressed, and the cure rates are very high. We incorporate anti-hormonal therapy if they do express the estrogen receptors and progesterone receptors, and radiation is seldom, incorporated. Dr. Holmes has a unique way of managing that in the intraoperative setting, which we love because it really has changed the game. And so with modern technology, early detection, these signs and symptoms that you're asking could be avoided.
We already have to step out to our next break. Is there a certain age that somebody goes in for a mammography, or Dr. Holmes?
Well, the American Cancer Society has some recommendations for when screening should start. I don't necessarily agree with them, but they are,
We've talked about that.
consideration of screening starting at the age of 40 to 44, an option to screen yearly screening from 45 to 54, that's their recommendation.
However, what if you have breast cancer history in your family?
These recommendations are for people that are average risk. So if they're
Okay.
high risk, they don't apply. We're talking, we screen differently and earlier for those patients. But just to finish the thought, the American Cancer Society recommends at the age of 55 consideration of yearly screening every other year, although you have the option of screening yearly. I believe that the screening, as you mentioned, should continue yearly, starting at the age of 40, because many people, even when they do their best, they miss a year.
Sure.
So if you say screen every other year, it'll be 3 or 4 years before they may get their mammogram. And cancers occur earlier in some groups, especially African Americans. Cancers occur on average about 5 years earlier than it does for Caucasians. And so if you're waiting to screen at 45, it's late or too late for many African Americans. So those are some of the reasons for you.
So here's the deal. Don't wait to get your mammography. More with Dr. Holmes and Dr. Bagdasarian. When we come back, don't go away. Adventist Health Glendale is nationally ranked for patient care. 5 stars from CMS and an A rating from the Leapfrog Group, and ranked one of the best hospitals in California by U.S. News and World Report. Our conversation today is all about breast cancer awareness, signs and symptoms. Joining us from Adventist Health Glendale is Dr. Boris Bagdasarian and Dr. Dennis Holmes. Gentlemen, let's dive into new technologies, and I want to, as we always do, address healthy lifestyles and signs and symptoms. I know you, Dr. Bagdasarian, mentioned the importance of mammography. What are some of the signs that people look for, Dr. Holmes?
Well,
are supposed to look for?
I would just add that the best sign of breast cancer is a normal breast, meaning that it's someone who went in for screening because he didn't have any symptoms, nothing to see, nothing to feel, and they had a mammogram that found the problem. That's the ideal situation. But sometimes either the imaging doesn't detect it, or the patient finds symptoms that draw her attention to a potential problem. It could be a lump within the breast. It could be a rash of the skin or the nipple, specifically a condition called Paget's disease. There could be changes in the color of the breast skin. It could be red. It could be swollen. That's a condition of inflammatory breast cancer, which he mentioned. But the vast majority of patients, well over 80%, will have either normal imaging or a lump. It's really the minority that have these other symptoms, rash and skin changes. So we recommend, people get screened, look for symptoms, but don't wait until you have a symptom before you come in to be screened.
I love that you said that. And here's the thing too: is go in as a group, make it a field trip, do it together. Have your team that you go in with, and also, as I am a big proponent of self-exam, just to check from here all the way around, and just to see if there's something different. And if you're in a relationship, have your partner, husband, spouse, partner, sibling, look at your body and see if there's anything they find that looks different. Take photos, call your doctor. These gentlemen are here to answer any question whenever you have them. And just also, don't be afraid of it. And if you get imaging and there is a pause, sometimes there could also just be a shadow in the imaging, because a lot of people become very panicked of, oh my God, they found something, and it could just be that the breast is denser than others. True?
Yes. I mean, if there's something palpable that was missed on mammogram, that needs to be addressed. We've seen situations where a woman approaches the primary care physician and mentions that there's something palpable, and at times, if the mammogram comes back negative and it's neglected, so it's so important to stress the importance of getting these things assessed, with biopsy, so nothing is missed. These are important things for the population to remember. Some women have dense breasts, and the younger you are, the more dense the breasts are. So sometimes a mammography, even though we have these beautiful tomos, the tomography with the 3Ds far better, and you can see different angles of it, but things still could be missed. So in which case, again, we would recommend approaching this with biopsy, and the need for possible MRIs plays a key role for that purpose as well.
Thank you. So someone comes in, they find a breast cancer diagnosis, 4 stages of breast cancer. We all know about the procedures that we've talked about in the past, but there are new technologies that you would like to share, Dr. Holmes, that I'm excited to hear about.
Well, as you know, we discussed in the past, my interest in breast oncology has always been treatment innovation.
Sure.
Changing, improving how we treat patients, treat breast cancer, but most importantly, treating patients so that we can offer them treatments that are effective, but are less burdensome, less disfiguring, safer. So in that realm, as we mentioned, intraoperative radiotherapy is one form of treatment that I've had the privilege of being involved with over the last couple of decades. It's now prime time. The research has been done. We know that it's effective. It's a way of giving radiotherapy during surgery. It's given as a single treatment, typically spanning only about 20 to 30 minutes. And
so what exactly is it, Dr. Holmes?
Well, when women have lumpectomy, one part of the treatment usually involves giving radiation to the breast to reduce the risk of recurrence. So it's using a form of X-rays to treat the surrounding breast tissue to prevent cancer recurrence or to reduce the risk of cancer recurrence. The traditional way of giving that radiation is to give it as a treatment to the breast after surgery, and the traditional way is to give it as as a daily treatment once a day for 4 to 6 weeks. So it's a daily treatment that a person has to come back to receive. With intraoperative therapy, we can replace an entire 4 to 6 week course of therapy with a single 20 to 30 minute dose during surgery that has the same long-term effectiveness and much greater safety.
Which is amazing, because when women and people that I've known have gone into the radiation for 4 to 6 to 8 weeks, and it is this daunting task. Yet now it's just one treatment that can do all of that. That's fascinating. I'm going to put a pin in all this more, Dr. Holmes and Dr. Bagdasarian. When we come back, don't go away. Welcome back. I'm Gregory Zarian, and the conversation is all about breast cancer awareness. And we just heard from Dr. Holmes that if you have to endure radiation, it's not a 4 to 6 to an 8 week treatment. It can be done in one session. More with Dr. Holmes and Dr. Bagdasarian. Dr. B, can you contribute to that? I mean, if somebody thinks, okay, now I can have radiation with one treatment, each case is different. Each breast cancer diagnosis, as with every type of diagnosis, is different. What if there's something that's more daunting? What happens then if somebody has to go through a lot more than just one dose of radiation for 30 minutes?
Well, the traditional treatments have been the long haul of radiation that goes on 4 to 6 weeks, and it's a daily session. To drive there and back, and it's a daily task, and it does compound over time. Yeah, psychologically, but at the very end, they're very happy and elated that they're done. But what Dr. Holmes is doing is very novel, very cutting edge, and if we can offer this phenomenal technology to reduce this daunting task of going back and forth, it's huge. And at the same time, some of the radiation-associated complications that we see with the long haul treatments is much less. So it's a step in the right direction for our patients. God bless.
But it's a solution primarily for patients with early stage breast cancer. Right. But as you know, one of the side effects of the COVID virus, the pandemic, is that many patients, their screening has been delayed.
Sure.
And so they're presenting with more advanced stage cancers now more often than they did before. So there are newer solutions for that problem, which I think you should just address.
Yeah, I mean, cancer screening unfortunately was put on hold for a while, and a lot of our patients, we've seen more advanced patients lately. And so we're now seeing more metastatic cases. In the past year, I can say not only in just breast cancer, but we're seeing patients get hospitalized with this long laundry list of complications that we had not seen before. You know? So modern technology is really advanced in the advanced cases. For instance, in patients with stage 4 HER2 positive breast cancer, we have these novel molecules that are now being utilized. In the past, we had Herceptin, and after Herceptin came Perjeta, the combination of which were phenomenal. Now we have these new amazing designed HER2 molecules that have the chemo embedded within the heart of that molecule, such as Enhertu and Kadcyla, and what that's bringing to the table. And many of these agents are now able to enter into the blood-brain barrier, and for which the older molecules did not have that ability. So the incidence of brain metastases with these newer molecules is dropping significantly, especially the Enhertu molecules. So, and in triple negative, which is the most aggressive type of breast cancer, we've had the greatest challenge, because in the past it was all chemo, chemo, chemo. So now we're identifying certain molecules, and we're doing clinical trials that if they have a certain expression of a protein, we can incorporate immunotherapy or other novel agents specific towards that. And that's really changed the face of managing triple negative breast cancers. Now, we're seeing incredible responses in the advanced setting.
That's fantastic.
And that's now being utilized in the earlier stage, because these patients with stage 2 and stage 3 disease have an enormous risk of metastases. And so these molecules are now playing a huge role. And because these patients don't have the luxury of being placed on anti-hormonal therapy, like tamoxifen and some of the aromatase inhibitors, we're now using the immunotherapy as a means of maintenance over a long period of time. So it's having a dramatic impact on this horrible disease. And again, just like Dr. Holmes' novel approach with cryosurgery and intraoperative radiation, these molecules have made a huge difference in the lives of many patients.
I love hearing that, and of course, being so involved at Adventist Health and being the chairman of the Cancer Committee, these new technologies must make you thrilled.
Absolutely.
Dr. Holmes, before we wrap out, basics. Talk to us about just living a healthy lifestyle and what we need to know to do our part to prevent possibly getting a cancer diagnosis.
Well, the most important message that comes from, our understanding of the relationship between activity and nutrition in cancer is that, exercise is important. Exercise from teen years onward, not too late to start, but
Sure.
the earlier you start, the better. It has a direct correlation with the risk of developing cancer and also the chance of having recurrence of cancer if you've already been diagnosed. Nutrition is also very important. Maintaining a lean, healthy weight, obviously it's easier with exercise, but eating a proper diet that's well balanced, rich in fruits and vegetables, that's the other thing that people can do daily to maintain the lowest chance of having cancer, and also the best chance of recovering from a cancer and surviving from cancer if they've been diagnosed.
Love that, doctor. 10 seconds, final thoughts on cancer.
Get screened, eat healthy, exercise like Dr. Holmes said, and see your doctor frequently. And that's the most important message I would echo out there.
So grateful to have the dream team here. Seriously, I'm humbled, I'm honored. It is, you two both are very important to me, so thank you so much for taking the time.
Thank you.
Okay, so you heard it from Dr. Bagdasarian and Dr. Holmes. It's about a conversation. If there is in fact a cancer diagnosis in your family, it's not just about you, the patient, it's about the family. I've gone through this with both of my parents, and collectively we have come together. So talk about it, ask questions, participate in the knowledge of it, the lifestyle of it, and make a difference. Remember, the most important conversation you're going to have is about you and your health. So start talking. We'll see you next time. Thank you for joining us.